Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Question number 1. Flushing of face is more commonly encountered in children following pre-medication with. Flushing of face is more commonly seen following pre-medication with atropine. Second, urgent reversal of warfarin therapy is done by. Urgent reversal of warfarin therapy is done by the administration of fresh frozen plasma. Even if the INR is found to be more than 1.5, even then it is better to administer fresh frozen plasma in these patients. Core body temperature. What is the best site for measurement of core body temperature? Lower esophagus is the best site for measurement of core body temperature. It is most accurate. It is 2 degrees Celsius higher than the surface temperature. Then how does the brain temperature measured? Brain temperature is measured through the tympanic membrane. When is hypothermia defined as? Hypothermia is defined when the core body temperature is less than 35 degrees Celsius. 1 degree Celsius fall in temperature below 37 degrees Celsius will decrease the cerebral blood flow by 7%. 1 degree Celsius decrease in temperature less than 37 degrees will decrease the cerebral blood flow by 7%. So that means if there is 10 degrees decrease in temperature, then how much will be the cerebral metabolic rate decreases? By how much? So actually 1 degree Celsius decrease in temperature will decrease the cerebral blood flow by 7%. That means 10 degrees decrease in temperature will cause cerebral blood flow by how much percent? So it is 70%. Optimum operation theater temperature is OT theater optimum temperature is 21 degrees.
thank you and thank you for watching.